This is a video on removing or doffing of personal protective equipment by healthcare workers caring for COVID-19 patients. The video shows the correct procedure of removal of personal protective equipment. Doffing the PPE will be done in the designated area for doffing, which is generally outside the main patient care area. Provision for hand hygiene and bins for biomedical waste disposal should be present in the doffing area. The entire procedure of removal of the PPE should be accomplished slowly and carefully. A trained observer or buddy will help you in the process from a distance of 2 meters. Remember that the doffing takes place in the reverse order of donning, other than the N95 respirator, which is removed last. The first step is to remove gloves safely. Grasp the outside of the glove with the opposite gloved hand and peel off the glove. Hold the removed glove in the gloved hand. Then slide the finger of your ungloved hand under the glove at the wrist and pull the remaining glove off over the first glove. Dispose it slowly in the yellow biomedical waste bin. Perform hand hygiene for 20 seconds with an alcohol-based hand rub and allow it to dry. Remove the goggles or face shield if worn. To remove the goggles, bend slightly forward and hold the back of the goggles. Remove it forward and outwards and drop it in the yellow biomedical waste bin. Then, remove the hood by bending forward and pulling away with one hand, taking care to touch only the top of the hood. Drop the hood into the yellow biomedical waste bin. Remove the gown deliberately and carefully to prevent self-contamination, as the front of the gown and sleeves will be contaminated. Undo the waist tie slowly. Then undo the necktie or the Velcro strap at the neck. Pull the gown outwards and away from the body, taking care to touch only the inside of the gown. Roll it into a ball from the inside and dispose it slowly into the yellow biomedical waste bin. Then sit down and remove the boot cover slowly, taking care to touch only the inner aspect of the boot cover. Perform hand hygiene with alcohol-based hand rub and leave the designated doffing area. The final step is proper removal of the N95 respirator after leaving the patient care area. The outside of the N95 respirator is contaminated. Bend forwards, put your hands over your head and pull the bottom strap first, outwards and over your head. Then hold the upper strap and pull it outwards and over your head. Then drop the N95 mask into the biomedical waste bin. The final step is to ensure proper hand hygiene for at least 20 seconds and drip dry. Remember that it is essential to remove the PPE carefully and deliberately to ensure its effectiveness. You have now doffed the PPE safely.